have this one in the store. So then they're like, but you got to put it on the payment plan. I said, oh no, I don't. I said, I got, you know.
Yeah, they want to keep you. They want to keep you attached to them.
They say you have $2,000 worth of pay. I said, so what would happen if we called them up right now?
Yeah.
And he says, oh, he goes, well, you can get that way. I said, so then call. I told him, I said, call him. He was so taken aback because he didn't think I was going. I said, call him. I said, okay, now the phone's paid for. Because I don't rent phones.
Right.
Don't ever.
But you see what they trying to do? They trying to keep you roped in. Box you in.
Never lease a phone. It's a gimmick. It's a ripoff. By the time you finish leasing that phone, at the end of the lease, you would have paid more than what the phone is worth, and then they try to sell it to you.
At the end.
And I'm like, you already paid more than what the phone was worth through the lease, and now they're trying to sell it to you.
Not good.
Yeah. So I don't go for that. I always tell people, I'm like, just pay for it. Just pay for the phone.
And mine is on a business account.
And like I said, mine is too. That's
It's even better that way.
You can't be a penny wise and a pound foolish.
Yeah, you can't.
You gotta know. You know, people think it's this is better for me. I'm like, no, it's not better for you. This is how they get you. That's how people like black folks that want to go into business, they got to stop being a penny wise and a pound foolish, and they have to think about what's the long term. Remember, I was talking to you before about the young man, and he was paying for his Metro card as he goes.
Yeah.
I said, stop doing that.
Instead of getting
instead of getting a week's worth, a week's worth or
get the
2
unlimited.
Get the unlimited. I said, and then I'm like, because in one day you might have spent $20-something, and if it's for the week, you could have paid $37.
That's the difference between an Easy Pass and paying at the toll.
Right.
You come out, you pay $7 with the Easy Pass.
It's a no-brainer. So people don't want to do certain things, but you have to start thinking. We as black folks have to start thinking fiscally more responsible, even though it seems like it's more money. It's not.
Right. Exactly.
You're saving money.
Right. Exactly. Yeah. That's 100% correct.
Yep.
Yeah. So how you doing today anyway?
I'm doing good. It's not as overwhelming as it has been over the last. Well, yesterday was all right, but the days before that, it was sweltering. I didn't even come outside the house.
Wow. Yeah.
I came out. I went from the house to the car to the office in the same routine on the way back. Right. And that was it.
So you had a hell of a week.
Yeah, hell of a week. Super busy. A lot of medical practices have been affected adversely during this whole COVID crisis, but God blessing me and willing, it has actually it's pushed my business forward. So many people, they have time off, so all these people that have these really good insurance plans that I'm able to accept, because I'm an out-of-network doctor. I don't participate in these plans. I give specialized services. My patients can call me, they can text me. You're getting services that you're not going to get from your average doctor or podiatrist. So all these people that have these really great insurances that I can accept as payment, they actually have the time now to get the procedure done. So for me, it's been popping. I have not stopped moving. I have not stopped moving.
That's a good thing.
Yeah.
So, ladies and gentlemen, you have my friend right here. She's my guest. Her name is Dr. Yolanda Ragland. Tell them what you do.
Well, my business is Fix Your Feet. I'm your Dr. Foot Fixer. I am the queen of all the toes, and I'm also the foot fairy. And I provide medically necessary foot surgery with cosmetic results. So what that means is that if you got bunions, if you have hammer toes, if you have corns, if your foot looks like a fist, I will straighten it out. I'll make it look beautiful. The scars will be virtually invisible or completely hidden from sight. I have my own trademark technique, the Tiara Toe technique. You can't find anyone else that does it the way that I do it. And, I'm the doctor that understands what it's like to walk in your shoes.
So just give us a brief bio description on what made you get into this profession, where you come from, stuff like that.
Yeah, well, I'm a DMV girl, so that's DC, Maryland, Virginia. I was born in DC, lived most of my formative years in Maryland, and then I spent a little bit of time in Virginia as well. And you know, I went into medicine because I had a lot of issues. I went to doctors and I wasn't getting the answers that I wanted. I had a couple of scares. I thought things were wrong with me. And I said, you know what? I need to know what these people know because I don't think they know anything. And you know what I found out? They don't. I knew I wanted to go into medicine for that particular reason. And so then I got into podiatry. I was doing research at NIH. I did research in the dermatology branch. I did a little bit of research on vitiligo, alopecia. I also did it was DNA repair defect. It was something we were researching, Alzheimer's disease, to figure out if it was a DNA repair defect, and that was still in the dermatology branch. It was a tenured clinician so he was able to research whatever he wanted. And then podiatry kind of like came across my table. They kept sending me the applications. I kept throwing them away. I didn't know what a podiatrist was. Kept throwing it. And so one of my girls comes up to the lab. She was going to the Temple School, and this was actually, this girl was Caucasian. She was cool. And she came up and she said, and I said, yeah, she says, oh, you got a podiatry application here. I'm like, yeah. I said, they keep sending me this. I'm about to throw that away. And she's like, stop throwing it away. She's like, if you want to be a dermatologist, because I thought I wanted to be a dermatologist because I was working with these dermatologists all the time. She goes, well, if you want to practice dermatology and podiatry, there's hair, skin, and nails on your foot, so you can subspecialize. So, I really love the idea of subspecializing in a subspecialty. But when I got here, and when I say when I got here in New York City, because this was the school I wound up attending, I realized there was this whole surgical aspect, and I was just like, man, I am so dexterous. I'm one of those girls that, I can watch somebody do something, like I can watch the hairstylist do a certain thing, and I'm like, I can do that too. Right. I can look and see how something was put together. I used to sew my own bikinis back in the day. Never took a sewing lesson, just bought a singer, figured it out. So I'm very dexterous, I'm very good with my hands, and I was just like, the surgical thing was really good. But what happened was I was living in the dorms, and these two ladies would always come and say, yo, can you fix my toes in a cosmetic way? And they would keep asking me that over and over again. I'm like, no, I'm just in school. I'm just, I just got here. I don't know anything. Yeah. And then as I started learning more, and I saw this one cat do a procedure, in which that's how I took what I learned, how he did it, and perfected it my own way. And when I saw that, I'm like, wow, you can actually get rid of a corn on the top here by not even touching that ugly corn, make an incision in between the toes, do the work from in between the toes, and the corn will go away. And that's when the light bulb went, I had my aha moment. And that's when I was just like, this is what I'm going to do. I'm going to call my business Fix Your Feet. Everybody laughed at me. Now I'm laughing at everyone because they're grueling away seeing 30, 40 patients a day. And I have this practice that is basically a niche practice. Also, I'm an African-American woman. And like I said, these ladies that used to ask me, they were African-American women. Right. Because they had seen how other ladies' procedures were coming out. They saw the big, long, ugly scars coming down their feet, and they didn't want that. They wanted to get rid of the corn. They wanted to get rid of the pain, but they wanted the foot to look presentable as well. Because I don't know about you, but I know most black men like pretty feet.
Yeah, I do.
I mean,
I'm big on feet.
Yeah. I mean, it's no wonder why, they say in the hood, it's liquor store, church, liquor store, church. I feel like in the hood, it's liquor store, nail salon, nail salon church. Because we have so many nail salons in our neighborhoods, because that is a big thing. You know, they're getting their hands done, but trust me, year round, those ladies are sitting in those chairs and having their feet getting soaked and scrubbed and scraped down,
corns and everything,
trying to beautify so that, you know, so it doesn't feel like you're sitting in bed with a troglodyte.
Right. Yeah.
You know, and so when I came up with this concept, I said, you know what, I'm an African American woman. I can totally identify with how they feel about their feet. I mean, there are some ladies that they really believe they're not going to get married because of their feet. There are ladies that want to go on Caribbean vacations with their booze and turn it down. They turn down a fully paid trip because they don't want their loved one, their partner, to see what their feet look like.
And let me add something in there real quick, being that you're on that subject. From a male perspective, you're 100% correct. Because guys, we kind of hard on women sometimes, you know. But for real, a lot of dudes, a lot of men, you know, I think I'm one of them. It's a funny thing. You don't want a woman with jacked up feet. Her feet jacked up, like, man, this is where we think, you know. Like even you saw in the movie Boomerang when Eddie Murphy was in the bed with, well, I forgot who it was.
I know you saw Sunshine.
And the covers came back and he looked at the feet. The first one he had in the bed, he was like, oh man.
He slithered out of bed. He fell out of bed like, he had to get away from her.
Right.
He's like,
and then the next girl he had like a week later, he saw the feet, he was like, yeah. You know?
When he saw
so that's real.
It is a real thing, and like I've done lectures on this before, and usually when I'm lecturing in front of these people, it's a predominantly white male crowd, and I show that clip at the beginning of my lectures. And you know, and for a lot of these people, it's the first time they ever saw this movie. They don't even know about the movie Boomerang. Can you believe that? That's a classic movie, and these people they've never even seen it before. Yeah. So they say, and I have to stop them in their laughter. I'm like, you're laughing. I said, but this is a real thing. And then when you see the little speckles, you know, the few black heads that are in the audience, they're like, they're all like, especially the black women, the other black female podiatrists are like, yep, it's a real thing. And the, like I said, the predominantly white crowd is like, you know, they're looking at me like, really? They think it's not real. But, you know, that's fine with me if they think it's not real, because that just means that it's a better market for me.
Right, but let me ask you a question too on another level. So we're talking about the beauty of the feet. Let's talk about the pain and the complications when women put on certain shoes and stuff like that.
Yeah. So that's just it. Sometimes people will see some of the before and afters, and the befores don't look as drastic as they think they should be. Okay. So sometimes it's a discoloration, but that's painful too. So now these ladies can't even wear just what we would call a normal dress shoe without being in pain or without having to take it off, and that's not normal. I mean, there's a lot of pain and anguish that also comes along with the psychological embarrassment with the presentation of how it looks.
All right. So when you performed, it's called surgery, right?
Oh, yeah.
When you performed surgery on your first patient, how did you feel?
Oh, you want to know what happened the first time I did surgery?
Yeah, let's get to that.
Let me tell you something. The first time I did surgery, I called my girlfriend up and I said, yo, I said, I just cut somebody. It was legal. It was the most exhilarating thing ever to be able to take this, you know, take a scalpel
Uh-huh.
and cut with precision, and then go not just down past the skin, past the white meat, but down to the bone. And then I'm taking a saw and I'm sawing things. And then when you're doing bunions, you're doing realignment surgery. It's like, it's carpentry of the bone. So one time I walked into a hardware store and I asked the man, I said, I need a self-tapping cannulated screw. And the guy looked at me like I had 5 heads, and he goes, well, how did you know to use that sort of terminology? I said, I'm a surgeon. I do surgery of bones. I said, it's the same exact stuff. I said, except one you enter into a bone, and the other ones you enter into wood or concrete. It's just a different medium. That's it.
Wow. So, okay. And so once you did your first one, was it like a clean job, or was it, sometimes when you start something in the beginning, you get better with time?
Well,
how did it
this is this is how it goes when you're learning. A lot of times, doctors are not just going to hand you over the knife like that.
Okay.
You got to earn that respect from them.
Right.
So it's kind of like you have to do your due diligence. You run behind them.
Right.
It's just like when you watch the old Chinese movies and there's a master and everybody's running around sensei and getting this for sensei and getting that for sensei. Well, it's the same thing in residency program. You're running behind the attending and you're like, what do you need? I need to know exactly, what type of local anesthetics you need, what screws do you need, what blades do you need, what suture materials do you use? Do you use betadine? I want to know whatever it is that you use. I'm going to get that all ready for you. So the most vivid memory that I can recall is out at this hospital out in Long Island, and I was very diligent, and I helped him out with the first procedure, and he had another procedure, and he looked at me and goes, you know how to do a hammer toe? And I said, yes. But, in my mind, it's like, I know all the steps in my head.
Right.
Now, had I gone through skin to skin all the way through and had done one? No, but I had all the steps in my mind because I was waiting for that opportunity for somebody to say, do you know how to do it? Because I wanted them to pass it over to me, pass me the knife. And that's what happened. He passed me the knife, and I put my poker face on. I said, give me the marker. 15 blade, I need a skin, I need a deep blade. I went down because I proved to him, I said, I know every last one of these steps, and I did it exactly the way that I was supposed to do it, and I closed it up. And then afterwards, I asked one of the nurses, I was like, how'd I do? She's like, you did that real good. So that was like a great moment for me at that point in time, because, I had only worked with this guy one time, but because I was so diligent and I showed him I was eager. I'm like, whatever you want, I'm here for you. Right. That's how you get the knife.
So let me ask you, so what school did you attend, and how many years did you attend the school?
So for podiatry school, I went to the New York College of Podiatric Medicine. It's on 125th and Park. That was 4 years. Before that, I went to the University of Maryland in College Park. That was 4 years there. And then after the New York College of Podiatric Medicine tour, then I did another 3 years of residency at Wyckoff Heights Medical Center.
That's 11 years altogether.
Yeah, pretty much.
Did it go by quick, or did it feel like it was dragging?
It did not go by quick. It felt like I was running in a dark tunnel.
Right.
And then I would say by the last year, I'm like, I think I see some light at this end of the tunnel. And I was smart enough to know how to position myself. So I made sure that I chose this residency program because I knew that they sent you to certain ORs where there were heavy hitters doing surgery. Because that's what I wanted to do. I always strive for the best. Right. I never want to do anything. I don't, mediocrity is not for me.
Right.
I want to do better than that. Right. So I made sure I would get my foot into this one particular surgery center, which I knew like some really top-notch dogs were there. And sure enough, you know, they all liked me, and then one of them just so happened, just, you know, after 20 years of practice, they were like, you know what, let me bring somebody else in, and they brought me in as an associate, and then basically I made it a practice of my own within a practice. So I was able to start up my own practice without any money, because I wasn't really, an associate is really somebody.
Hello, Don Vito. Say hello to people.
Hey, how y'all doing? How you
What's going on? What's up, champ?
Got my man Michael Hollingsworth right here.
Good.
That's right. Good to see you, brother.
All right.
Right.
All the time.
So yeah, where was I?
Well, I think you were talking about the people when the practice that you were.
So the practice was in a practice. So yeah, usually when you're an associate, you're getting a salary. I didn't get a salary.
Yeah.
It was, you know, I do a certain amount of work, and then I'm rewarded for that certain amount of work versus a salary. And so even though this person had his own practice, I was allowed to have my own practice in its own right. And then after, you know, a few years of doing that, then we're partners now. So it's just like when you see like a Celino and Barnes. They're partners, but they're actually two separate practices.
Right.
But they're partners.
Okay. So how long have you had your own practice?
Oh, since the beginning. That's my whole point.
Right.
It's always been that way. So I think the Fix Your Feet, I probably got my sole proprietorship maybe about a year and a half out, because you know it took me some time to build up the revenue, and then in 2011 is when I became incorporated.
So let's create the atmosphere. So we come down to your practice. What does a person see when they come into your company, to your business?
Oh, when they come into
When they first come in.
When they come into the Park Avenue office?
Yes.
Oh, I think they say, oh my. Because when you just walking down the corridor it's beautiful. It's a beautiful corridor. It's a Park Avenue. I mean, I'm in the Carnegie Hill area of Park Avenue on the corner of 90th Street. It's a lucky number, 1111. You can't get luckier than 1111. You know, 1111 Park. You walk down this beautiful corridor, and then you get through the doors, and then you open up and you see this beautiful, because you know space is a hot commodity in New York City, so it's a boutique style practice, but everything is state of the art. You know, all digital X-rays. You know, when they come in, they get a good, even though everything's state of the art and new, it's still good old fashioned doctoring.
Right.
So when the patients come in and they sit down in the treatment chair, that's where we get the history, the physical, the laying of hands. We examine the X-rays. Then after that, we take you out of that. Now we go into my office. You get the dual screen, you know, IMAX going on. Dual screens. They can see what I'm seeing. I review their X-rays with them. I show them animations of what the procedures are going to look like, and then I go over everything in complete detail so that people can make an informed decision about what they're going to do with their body next.
So the animation is like before and after. I mean, like you can show what your feet can possibly look like if we perform this.
No, the animation actually shows the procedure.
Okay.
So I feel like a lot of these ladies go into these procedures not really understanding what is going to happen. So we have an animator there, because I could tell you I'm going to make a medial incision on the side of the bunion, and then we're going to go down to the bone, and then we'll make an osteotomy, and we'll slide it over and put it together with a screw and cut this off and move the sesamoids. But what do you see? You don't see anything. It's Charlie Brown adult talk. Want.
Right.
That's all you see, right? So I want people to see what's going to happen. And even though it's not bloody and it's not gory, it is an animator. But it gives people a real perspective of what's going to happen to their foot at that point in time. Like I said, so they can make a really good, informed decision on whether or not this is something they really need to do or not.
Wow. So you have ever had a person that was unhappy with the procedure?
You know, anybody who does as much surgery as me, of course you're going to have somebody who's disappointed. I mean, sometimes I can do the same thing hundreds, thousands of times over and over and over again and do it the same exact way, but on one person's body, it might not turn out that way.
Okay.
So there's certain things that are just not in my control. Is it that I did anything cavalier or, you know, off the charts? No, it's just that some people's bodies just don't heal the same.
It's the same thing like me. I'm a master trainer, fitness coach. You ever need my services, you know, hit me up. There's some women who, you know, most women want a nice body, want a nice butt, they want nice hips, you know, flat stomach. They want that shape. But I tell women sometimes it's not in your genetics. You know, maybe, I don't know if I can give that to you, but I can make what you have better, and I can get you in great health. You know, so that's the same thing I'm talking about with the feet. Sometimes people might want their feet to look a certain way, but if it really don't have that type of makeup to their feet, you do the best you can to make them look better, pretty much.
That's right. You know, it's just like I have a girlfriend that has a hair salon, and she has a picture up there that says, "I am not a magician." Okay, and even though I call myself the foot fairy, I let them know I call myself the foot fairy, but there's no magic fairy dust that's gonna magically transform your feet. In fact, the transformation that occurs under my care actually takes several months.
Right.
And so, and a lot of times, and I get it, people have anxiety, they want it to happen really quickly. And I say, but you have to wait. I'm like, you've had this condition for over 5, 10, 15, 20 years. What is another 6 to 8 months to wait for it to transform into the feet that you've always wanted?
Right. So that's pretty much like the healing process.
It's the same. Well, no, that's not. It can, you know, swelling can last in the foot. The textbook answer is swelling can last in the foot up to a year. Everybody's different. I just had a patient I did surgery on. I did all of her toes. And I did surgery on her like 4 weeks ago. And I didn't even realize. I was like, when did I do surgery on you? She's like, last month. I'm like, and your feet look like that? I mean,
Right,
it was,
right.
I'm amazed by it.
Right.
And then you got other people that come in and it's just like, you're going to have to wait.
Right.
You have to wait. It's going to be a gradual transformation. So everybody's a little bit different. Like you said, same thing with what you do. Some people are going to snap back really quick.
Right.
And some people it's going to take, you know, it might take years for them to transform their body into a fitter, better them.
So you perform surgeries. Do you also teach? Like students who are up under you?
Well, I don't actually have students, but I do allow residents to scrub into my cases. I do tell all of my residents that, you know, I'd love to let you do some of these procedures, but I can't because these patients are very private. They're spending money for the procedure, but they're going to get to see how I do this procedure. They're going to see how I do a procedure or how a procedure is done in a way that they have never seen it done before.
Right.
So that in and of itself is educational. And, you know, the more times you get to come into the OR with me and watch how I do it, because I make it look easy.
Right.
I've been doing it for years. So, you know, when I'm releasing things and freeing up things, they think it's easy.
Right.
It's not. It looks easy because I do it all the time.
Right. So how many people do you have in the operating room with you when you're doing a procedure?
Oh, okay. So typically, it's me, the anesthesiologist, the surgical tech, and the circulator. That's typically who we have in there. And then sometimes we'll have other people that are in there with us that are learning. So you have techs that are being proctored. But yeah, typically it's me, the anesthesiologist, the surgical tech, and the circulating nurse.
So, is this something that I know this is one of your professions. Do you have any other things like you want to take it somewhere else? Like, how many offices do you have? as a matter of fact?
Okay, well, that's a two-part question. So,
Yes.
okay, I'll start with the office part. So,
Okay.
I have two offices. I have my flagship, which, like I said, is 1111 Park Avenue. Everyone has to have surgery done in New York City. But I also have a practice in Bowie, Maryland, which is part of the DMV area. I go down there once a month. I'll see new patients down there, and I'll do follow-ups down there.
Right.
So even though if you live in that area, in that proximity, even if you have surgery done here in New York, you can follow up in that Bowie, Maryland practice. As for venturing off, oh my goodness, there's a wealth of things. But I'm about to launch Fix Your Fungal Nail. So it is a wonderful, wonderful product. It's so good that I had to go to the makers and say, hey, look, you need to let me brand this. I said, because through me, people believe in me so much. If I say that this is the truth, they're going to buy it. And I know it's the truth because I've used it on myself. So I've suffered with fungal nails, I've suffered with athlete's foot. I really know how to keep it under control and keep it down. And I've used several different products. And let me say, hands down, this particular nail solution it's miraculous. That's the best way to put it.
So it's funny that you mentioned athlete's foot because I had that from time to time from playing sports, from being in the gym a lot, sweaty sneakers, and like the bottom of my foot, when it gets dry, itches. And it irritates me. What can I do about that?
Okay, so first of all, education is most important. So I'm going to educate you. It's a little long-winded, but I think it's important that you understand it. So I always tell people there are two types of people in the world. There are people that get fungal infections, and there are people that don't. So people think that fungus is super infectious. It is if you're susceptible to getting it. If you're not susceptible to getting it, somebody who's not susceptible could wear your shoes and not get a fungal infection. The second thing is, fungus is super hardy. It survives by shooting off spores. And that spore could sit right over there in that corner for 100 years. And here you come along with your susceptible self. You step on it 100 years later, put your foot in a dark, moist environment. And when it goes into a dark, moist environment, that spore can germinate and become the athlete's foot or the fungal infection.
Right.
So now knowing that, now that you understand what this is, because it's not about being clean or dirty. You can't get rid of spores super easily. Spores have to kill a spore, it has to be under high temperature and pressure to kill it. So even if you vacuum, even if you throw Clorox down everywhere, you're still not going to get rid of all the spores. All right, so now it's about you being proactive with your feet. So I always tell people, you just got to make sure that, especially when it's warm, you got to make sure your feet are nice and dry. People that are susceptible to getting fungal infections should always wear socks with their shoes. Okay, because when you don't wear socks, that's when the feet start to sweat.
Right.
And like I said, now it's in a moist, dark environment, and that spore can germinate. That's when it's going to flare up, because people more often than not get the flare-ups when it's warm than in the cooler months.
Gotcha.
And now that you know all of this, then I say you brush your teeth every day, right? You brush your teeth every day so you don't get plaque, so you don't get gingivitis, so you don't have bad breath. Same thing with your feet. You gotta treat your feet like you treat your teeth. Every day you should be putting on some sort of topical antifungal medication on it. One of the little secrets that I teach people is that antifungal medication is also anti-yeast medication. Okay, so if you go into the women's section for the yeast infection, Monistat, you can get a big, gigantic tube of Monistat. But if you can go right into the foot section, they give you a little teeny tiny tube that costs the same amount, this little teeny tiny tube. But you could have bought that big gigantic yeast one over there. So I say, don't go in the foot section, go over to the ladies section, or get your girl to go into the ladies section if you're too embarrassed. Get some Monistat, get a big tube of it, and use it as something that you apply on every single day as your routine, your routine, getting yourself together every single day.
So you suggest put that on once or twice a day?
Twice a day would be it would be ideal, but once a day is definitely enough, for sure.
Yeah, that's a good tip right there because, yeah, I had that situation, but most of the time you're right. Like when it's warm weather, because your feet sweat.
Because your feet sweat.
Yeah.
It pops up. And then also, and you'll notice it when you've worn your feet in shoes, in sneakers, as opposed to, so if you know you're susceptible, make sure you let your feet breathe. Wear some sandals, wear some, wear those slides. I mean, they have so many options for men and women right now. There's no reason for you to have your foot cooped up in a pair of sneakers all summer long.
All the time, exactly. Let them breathe.
Let them breathe.
Yeah. So if somebody wants to reach out to you and get to find you to get their feet done, what are your links?
Oh, well, the best way to find me is Instagram. Fix Your Feet on Instagram. You'll find me on Fix Your Feet on Facebook. I don't respond to anything on Facebook. In fact, if you put in a message on there, auto response will say, go to my Instagram and respond there. And I respond to everybody on Instagram. And then you can definitely go onto the website, fixyourfeet.com. There's a place for you to put your inquiry in. A team member will contact you. They'll give you all those answers. People want to know what price quotes are. The best way to do that is to, submit your inquiry, and team member will get back to you and give you what quotes are. They'll help you with your insurance. We submit for you. I'm out of network. I'm one of the few out of network doctors that will say, you know what? Hold on to your money. We're going to take your insurance. We will submit it for you, and then we'll collect the money that way. Because most out-of-network doctors will say, no, you got to pay me first, and you go submit it, and good luck with that. So,
that's big, because a lot of people, they need that type of assistance. So I want to thank you for coming to the Vibe with Don Vito show. We outside. It's the first time I shot a show outside, so we got Dr. Yolanda Ragland right here. And summertime, ladies, even guys, you need to fix your feet,
For sure. This is not just for ladies. I did start this out for, African-American women, but this is for everybody. Anybody who needs this, I'm equal opportunity, baby. I'm here for you.
There it is. But like I said, I appreciate you coming to the show. And just tell them your links one more time so they can know how to find you.
All right, so you can find me at fixyourfeet.com. On Instagram, I'm on Fix Your Feet. On Twitter, I'm Fix Your Feet Inc. On Facebook, I'm Fix Your Feet. Fix Your Feet. If you put in Fix Your Feet, you'll find me.
There you go, Fix Your Feet, ladies and gentlemen. Thank you for tuning in. Y'all have a wonderful day. Thank you very much.